Hola, hi friends. I'm here now. So I'm sorry I was running a little behind, but I'm so excited to be on this platform. Like I said, thank you, Be Latina. Thank you for having me and welcoming me with warm hands to talk to everybody about what is diabetes, how it affects our community, and what can we do to prevent worsening, how to prevent the condition, and how can we talk to our families about it. Okay, so Instagram is giving me a message that we are communicating with you all about the live, so I'm gonna give it about a minute or so. Okay, in the meantime, if anybody does arrive, I'd love to find out where you're from and where are you located, so that we can have a nice very connected Instagram session. Gisele, hello. Please don't hesitate to tell me where you're from, guys. I love to learn where you're from. Paola Santos, hola, how are you? Marilux, hola, how are you guys? I'm so excited to be here. We're gonna talk about diabetes, the risk of diabetes, and how it can affect us women, mujeres latinas. Hola, Hair Loss Bonita, Steph Marina. Hair Loss Bonita, I have been using some amazing products. My hair has never looked better, and I want to talk about hair loss as well, guys, okay? Because hair loss is so important, especially in our community, and what are the things that can affect us and affect our beauty, right? So my focus is, I'm a women's health nurse practitioner. I grew up in El Paso, Texas, so I'm Chicana. I got my bachelor's and my master's from the University of Texas. And hola, hi everybody. Hola Paola, nxnn.i, how are you? Lala Garcia, ¿cómo estamos? So guys, please tell me where you're from. I would love to find out what states. I'm in New York City. I live in Connecticut. I commute into New York City every day to come and take care of my patients. I'm very blessed to be affiliated with the university that I work at, so I also teach. I don't want to get anybody involved with names, but you can look at my bio to find out all of my my relationships and everybody that I have connections with here in New York City. So Wisconsin, wow. San Bernardino, California is in the house. I have primos there. Like I said, I grew up in El Paso. I'm from Connecticut. Gabi Tejera, Pulling Amena. Hello, everybody. So today's live is about diabetes. I want to talk about the risk of diabetes in the Latino population. So we have a 50% risk of diabetes just because we are Hispanic Latinos. A lot of us can say that we have tios and primos and abuelitas that have diabetes, and it doesn't have to be the case that diabetes defines us or our heritage, okay? I personally have been taking care of diabetic patients all my life since I was a little girl, and this is the reason why I decided that I was going to do this kind of work, right? So I love everybody who's out there practicing medicine and caring about the Latino community. So for me, it's really, really important. I'm in New York City, and I take care of all my Dominicanos up here in the Heights. And if I have any Dominicans or anybody from Washington Heights, throw me a hands up. So NXNN, you were born in Long Beach. That's awesome, great. So I have a lot of Cali in here. So I'm excited to be here, guys. I'm gonna get started for timing purposes. I'm gonna get started in about 3 minutes, but I just wanna warm up the session and get to know each other and find out what your interests are, how you're affected by diabetes, and what are some take-home messages that we should start spreading out into the community, because this is what this is about. This is about spreading all of what we do know into the community so that we can prevent disease, right? So we want to prevent disease within the children. We know that type 2 diabetes also affects kids. It affects newborns. It affects young women, PCOS, people who have a history of PCOS. So niñas cuando están creciendo empiezan a tener sus reglas, your menstruation starts to happen, and when the menstruation starts to set in, that's a hormonal imbalance if we don't keep an eye out and we don't watch what we're doing. So when I say watch what we're doing, number one thing that we've got to do, guys, is not sit so much, not be so sedentary. Hello, hi. So we have Ajay Rivas. Ajay, can you tell us where you're from? I want to just make the room very, very, very warm and make sure that everybody is feeling connected. So I'm going to get started in just a few at 11:40. So we're talking about diabetes prevention, spreading the word of diabetes amongst us, the Latino community, and talking about how we can prevent diabetes, what we can do about diabetes, and how diabetes does not define who we are, does not define our food, and what can we do to help reduce the risk in our population, because that is such a valuable concept and understanding, right? When you go to the doctor to find out how healthy you are, what measures health? And you're gonna have different measurements of health, okay? You're gonna have your blood pressure, your pulse, your temperature, just the state of wellness that you feel in, right? So you usually go to the doctors because we don't feel good, there's something happening, we don't feel right. For us women, we start experiencing hair loss, we start experiencing changes in our skin, we start to feel more tired, less alert, we're less capable of maintaining our attention span, our dreams or our sleep cycles are probably off. And I also want to touch, because I was thinking about dreams, is that if we're not dreaming, we're not resting. And if we're not resting, our bodies are not recovering and they're not restoring themselves. So hopefully next time we can talk about the necessary essence of dreams. Dreams are so important. So that's one of the number one questions that I ask my patients is, do you dream every night? Or when was the last dream that you had? Because REM cycle sleep is so valuable so that we can actually rest and recover, right? So when you turn your computer off, it goes to sleep. Same thing for us. So diabetes is a whole spiritual encompassing notion that I love talking about because it affects all of us. So just a quick statistic, according to the CDC, 50% of Latinos will have or are at risk of diabetes. And when we talk about diabetes, it's not type 1 diabetes, it's type 2 diabetes. So type 2 diabetes is adult onset diabetes. Usually this happens, in our 20s when we start to gain weight, we start to look at ourselves in the mirror and we're like, oh my God, I'm starting to feel tired. I'm not exercising as much. I don't fit into my size 2 jeans like I used to when I was 18. And again, this is not about aesthetics, okay? This is not about what we look like, but I will say that many people fail to keep that in mind, right? We don't keep the exercise as a priority, but we need to be alert of our cardiometabolic risk for disease, especially in the Latino community, guys, okay? So I'm being very specific about us in general and why diabetes affects us, and that's because we are creatures that are naturally made to perform. We are naturally made to work out our muscles, work our thighs, our glutes, our abs, our backs. We're just naturally made to be freaking powerhouses. And if you don't give the body that essential exercise, it's not going to know what to do. And so that's one component of diabetes. Then we go home and we eat everything we're not supposed to, right? So the simple things that we're not supposed to be eating because we're amazing machines are simple carbs, right? What are simple carbs? Simple carbs are like white rice, white anything, right? I personally love myself a banana in the morning, so maybe some bananas can be bad for us. I'm gonna wave to everybody because I want to include you all here. And Gloria Kellett, how are you? Miso Fly, Carranza Beth, Martina Mado TV, and we have FC Messi 1001, Milena Livia, Nelly Duran, Lady AV. All right, guys, I'm so glad you're here. So we're talking about the cardiometabolic risk of diabetes, okay? So diabetes isn't something that we're just born with, and sometimes it can be, but it's not something that we're supposed to be made out of. Diabetes is something that happens in our bodies from a lack of exercise, a lack of nutrition, right? So let me just give you all an example. I have a patient that comes into the room. She's 25 years old, and I check her finger stick, and her finger stick is 200. And so I started asking her some questions, very, very basic questions. And number one, never want to judge, because I know what it's like. I know what life is about, and I know how hard it is for a lot of us to live life. Okay, so I understand past traumas. Past traumas can have a severe impact on how we feel and on how we deal with daily life. Okay, so if I have a young lady who has been living in a shelter, or has been having a lot of issues with her parents, or doesn't have parents because of a dysfunctional relationship, I can't ask for too much. Okay, and I understand that in our community we have a little bit more extra suffering that we all have to be aware of, right? So we have to be sensitive to those needs. And I'm never going to get in front of a patient and start to prescribe, hey, you got to do this, you got to do that, if I don't understand the fundamental truth of their life, right? So I need to understand the fundamental truth of their life. Like, some moms have to work 2 jobs to keep their kids housed and fed. And so we have to maintain the reality of it as doctors, as physicians, as counselors, nurse practitioners. We have to understand our patients' lives. And that's what we're here for to do, because once the patient understands, and that's why I'm talking to you guys, because we got to take this message home. We got to take the message home. So number one, caminar, bailar. Okay, so you got to walk in place, or you got to dance in place. Number one, you got to move. If we move, we're going to help our bodies learn how to use the food that we give it. So even if you eat your rice, even if you eat your tortillas, las tortillas en la mañana, if you move and you're telling your body to use these calories, your body's going to use them. Okay, so a lot of the times, like I said, I had the patient that came in, her blood sugar was about 200. I'm going to ask her very basic questions. Do you exercise? Well, how do you eat? What does your diet consist of, right? And it's a lot of the times there's going to be no awareness, and there's not going to be an ability to understand why it's important to have a blood sugar less than 120. So in the mornings, we want to have blood sugars that are less than 90s for your fastings. So in the morning, we should wake up with a very low blood sugar, and that's going to help set the stage for the rest of the day. So let's just say for some of us, if you go to bed and you finished eating because you're hanging out with your boyfriend, I used to do this. I used to hang out with my boyfriend. We used to go to Jack in the Box, Chico's Tacos. We used to eat like at 11:30, midnight, hang out, drink beer. Hey, that was a great time. But then I would wake up, or probably waking up with a fasting of like 100, 120. And that's already setting the stage for my day to be high, right? So I'm going to be hanging around with blood sugars of like 140s, 130s, 140s, and you don't want that. You want to have a blood sugar that's well controlled. And what it is that you can do to help maintain your blood sugars is exercise. So we're going back to the fundamental truth of why exercise is so important in our community. We can't forget that a lot of the times we come from indigenous backgrounds, and our indigenous ancestors, all they did was hunt during the day. They used to go outside, hunt, look for food, and there was huge various times of starvation. And with that said, blood sugars would really go down, and a lot of the times blood sugars were down, and that's why we're able to achieve this time in our ancestry, is because we didn't really have the risk of diabetes about 400, 600, 1,000 years ago, when we were true and when we were very ancestral, right? So when we were very ancestral, that's such a great question. So the number one test for all of you to do is go to your doctor's office, go to your clinic, and ask for a hemoglobin A1C, okay? That's what you want to do. And if your hemoglobin A1C is ranging 5.7, 6.0, you're at higher risk of diabetes. You don't have diabetes as a diagnosis. The only time you would have diabetes as a diagnosis would be 6.0, 6.4 and above. So you really want to be careful with that. And as we get older, it's going to be very, very common that your hemoglobin A1C is high and it's trending like 5.7, 5.8. And that's when I tell my patients, vamos a darle duro, we got to hit that. We got to hit the pavement. We got to walk fast. And we have to start considering what we do for our blood sugars. So how else you can check your blood sugars is by a glucometer, right? So I was gonna ask you, have your doctor, if you are diagnosed with a hemoglobin A1C of above 6.0, you wanna start checking your finger sticks. I would say before meals and after meals to find out how it is that your meals are targeting and how they're affecting you. And this is where the sacred relationship with food instills. I always tell my patients, hola, ¿cómo estás? It's so great. We have Perez, the advisor. Oh my gosh, I love watching you. You make me crack up, okay? And it's so true. I love engaging with you because you speak to the people. So, and this is what I'm here to do. So back to checking our blood sugars. We want to check our blood sugars right before, sorry, my Instagram here, the light. So we want to check our blood sugars after we eat, 2 hours after we eat, to find out the effect of the food, right? So this is the relationship that food will have with us. And I refer to food like the relationship that we have with our boyfriends, okay? So what is it that these boyfriends make us feel, or girlfriends, or anybody that you have a relationship with, right? So food should really have an impact and make you feel really good after you're finished eating your meals. Check your blood sugar. If your blood sugar is above 120, 140, it's not a really good relationship, all right? You want to have blood sugars that are well controlled, and anything that gives you a blood sugar of above 120 is too high. So you're going to start thinking about portions. You're going to have to start thinking what it is that you're actually eating and how much do you need of it. So a lot of times it's portion size, okay? I want you guys to ask me any questions, please, 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 okay? This is your session, and this is a place where I want you to learn. Secondly, my prescription is to have patients exercise. So I recommend my patients bailan una bachata, quiero que hagan jumping jacks, que sentadillas, que se pongan a hacer push-ups against the wall after they eat, okay? Because that's gonna help your body metabolize your sugar so that you don't feel so guilty, number one, of what you ate, and you have the power to use the food that you're using. So it's not all about deprivation, and it's not about dieting, and it's not about giving up your cultura or saying, no, I can't have this because it's going to affect my blood sugars. It's about having a balance, and a balance in the movement of your body. So I'm always going to say that we need to, I want to talk about the connection that you have. I lost connection when you first started talking about blood sugar. Can you check it out with a glucometer? Yeah, so you want to check with a glucometer. A glucometer, let me see if I have one here, okay? Here you go. So a glucometer is this little meter here, and you're gonna have your doctor send you strips. You're gonna have your doctor send you needles, lancets, needles, and basically what you want to do is check your finger sticks after you eat. So you want to do a 2-hour finger stick check after you eat. These are the little lancets. Sometimes you can set the lancets inside of here. You have to prick your finger. Now there's some amazing tools out there. It's called a continuous glucometer. You put it on your body. It's a little patch that you wear, and this will always trend your blood sugars. It's amazing, and it's gonna be able to tell you continuously what your blood sugars are. And you can use an app on your phone to help you monitor your blood sugars, all right? So I want to talk about the risk of diabetes in the community. That's what, for those of you that arrived a little bit later, we're talking about type 2 diabetes in our community, in the Latino community, and how it affects us and what we can do to help reduce the risk. So when I talk about the risk of type 2 diabetes, you don't just wake up with diabetes from one moment to the next. It takes a little bit of time to develop diabetes. So it has to do with a lack of diet and exercise. Did I answer your question? I want to make sure that I'm answering your questions, and I don't want to just take too much time, but I want to be able to hit it on the dot so that you understand how important it is, what the risk of diabetes is in the community. Okay, Lady AV? Secondly, it's so important to check your blood sugars, or to understand your blood sugars right before you're going to become pregnant. So if you're thinking about pregnancy, this is the primary conversation that you want to have with your doctor. Hey, you know what? I'm Latina. I'm going to ask my doctor about my risk of diabetes. Hey, doctor, I'm thinking about getting pregnant. What do you think I should start thinking about? Do you think I should do a hemoglobin A1C? Number one question, okay guys, if you're considering pregnancy, you want to talk about your risk of gestational diabetes, because gestational or diabetes in pregnancy is going to set the stage for how your baby develops. And we all want to have an opportunity to develop a very beautiful, perfect baby, right? And having a pregnancy that is already complicated with high blood sugars is not going to be good for us. So you have control, you have the power, you ask the questions, set it up, set the stage up to make sure that we take care of our metabolism. So more importantly, young girls, young teenagers are not understanding the risks of not exercising and eating just totally bad. So, and when I say totally bad, I'm talking about, you know, candy bars and then not too regulated diets. So it's so important for moms to have an idea what the children are actually eating and when they're eating it. So fruits and vegetables, absolutely important. I want to talk about how you can encourage these young girls to exercise. So number one, they've got to do it as peers. They got to do a peer group exercise. They exercise either if it's a TikTok workout, if it's encouraging them to do dancing on TikTok, whatever you do, you need to do to move is so important, okay? Because that's going to help your cells use the blood sugar. And that's what I'm just getting after all the time, right? So if you look at my Instagram, I'm always moving, I'm always exercising, and it's so important to have these sessions where you're moving your body because you're going to use the blood sugar. We were not made to sit behind a desk to listen, you know, to look at the screen, to send out emails. That's not what we were made for. We were made to move. And remember, we're indigenous peoples. So with that said, more movement, right? So back in those days, we were made to have higher, longer times of starvation. And so naturally, our bodies are made to be a little bit more insulin resistant. So there's some debatable articles about that, because you really can't say why we as a population are insulin resistant, but we can say that it has to do with our heritage, okay? And our heritage is made to last longer, like the Energizer Bunny. But when we are made to last longer, we're made to last longer, a little bit longer, hungrier, right? So when we're giving it so much food, we're constantly eating and we're not moving, we're going against what our nature has decided for us. And that's why we develop disease. So important not to think about how the food is making us sick, because it's not really the food, it's our lack of movement, and it's our lack of connection with the timing of who and what and when we're eating, right? So stay away from simple carbs. Stay away from white starch, stay away from white. Anything you can do to add more complex carbs, more whole grain, like the quinoa, you can add brown rice to the food, start, you know, looking for the multi-grain tortillas. Corn tortillas are great. They're so good for you. But if you start adding just a little bit more multi-grain to your foods and adding more okra, adding more lentils, frijoles, so you have to have a combination of the legumes. It's going to help control the blood sugar so much better, because that's what we are made to eat. Secondly is, like I said, dancing after we eat. So after you finish your meals, if you get on and you make it a point to do a live, or not a live, a TikTok, it's going to be so good for you to move your metabolism. So tell me, plant-based diets are really good, and I'll tell you why. Plant-based diets have a lot of fiber. Fiber is absolutely necessary to keep the motility in your intestines going. So I'm not sure if you've heard about PCOS. There's a lot out there with regards to PCOS. PCOS has a very strong relationship with constipation and a lack of fiber. So in order for us to regulate our hormones, we need a balanced diet, and plant-based really helps us to get there. The disagreement is, do we do soy or not, right? So I'm for soy. I don't think soy is bad. Everything in moderation, nothing in excess. And I love pea protein. So if you're going to look for what's out there in the market, I would look for third-party testing, because there's a lot of startups that are encouraging plant-based diets, and you don't even know where they're sourcing their vegetables from or their protein. So you want to understand the sourcing, and you want to understand the risk of toxins. Okay, so make sure that the machine or the factory or the place, the source where you're getting your stuff has been third-party tested. And secondly, you want to make sure it's been certified, that it's actually what you're getting, right? So be careful out there if you guys are doing any supplements. I love protein. I love my bars. I love my protein bars. And that's another really important aspect of our diet against diabetes, is that we need protein in our diet. So I love to stick to legumes, black beans, frijoles, kidney beans, and my Instapot. We're best friends. So when I get home, I wash my beans, I throw them in the Instapot, and I always have beans because that's a staple. That's my culture staple. And there's not one time that I don't have beans in my refrigerator. And I mix the beans. I put bacon in them. I put cheese in them. I put all types of different, carrots and celery and ajo and cebolla, and that's part of my ancestry. And so I'm giving my body the food that it's known to have to metabolize, right? So my body knows how to metabolize the beans, the frijoles, and it's really easy for my blood sugars to stay steady state because this is what my body knows already. So if I'm throwing at my body things that it doesn't understand, it's going to stay outside of the cell, and the cell doesn't use it, so then my blood sugar goes up. When my blood sugar goes up, everything else gets stressed, right? So I have a higher risk of high blood pressure. I have a higher risk, number one, of higher blood sugars. With higher blood sugars, your body's just gonna get more and more stressed. Your kidneys are gonna get stressed, your brain, your heart, your kidneys, your liver, right? Your pancreas is going to start trying to produce more insulin. So everything gets really stressed. And think about this. This is the same thing that's happening to a baby when he's inside or she's inside of his mom. So for a pregnant woman to have good control of their blood sugar, it's so important. So I'm talking to everybody globally. I want my men to take care of the ladies. I want the men to also check your blood sugars with your doctor, because it sets the stage. It sets the stage for how your home and your life and what we do as the grown-ups of the house and what we do as kids, it continues to give off, and we continue this generational teaching, right? So we want to make sure that we reduce our own risk of diabetes, we reduce our community's risk of diabetes, and we continue to pass on the message that learning how to read nutrition facts is so important. So plant-based, going back to plant-based, I'm pro plant-based, I'm pro complex carbs. So adding in all the calabacitas, all the squash, all the pumpkin, learning how to cook for yourself and learning how to take care of yourself so that your body can understand what you're giving it. And let me just go back. We are so stressed out in this country, right? So we're stressed out in the country. We don't eat the way we should. We don't hydrate the way we should. It's a lot of inflammation that's happening in our body. So if anybody follows love carbs, there's this young lady on Instagram. She has a great Instagram on how she lost over 130 pounds of weight. I understand how she did it, and she's such a great person to follow because she helps us to learn how to eat. The only thing though that I would like to see more on her Instagram page would be the portion. The portion control is so important because I know that I can eat a whole pizza pie by myself if I really want to. And I can eat a whole plate of enchiladas if I really want to. I can sit down and I can eat because I love my food. So it's a blessing to have an appetite. It's a blessing to want to eat what you're served. So when we eat, it's also so important to sit down and eat with love, right? So that's another thing that I tell my patients is, when you sit down to eat, if you actually take the time to chew your food, you're already causing metabolism to occur right then and there. So the simple fact of sitting down and enjoying the food that you cooked, enjoying the food that you purchased, that you said, well, you know what, I couldn't make my food today, but I'm gonna go buy it. I'm gonna make the best choices that I can to make this a healthy meal, because I know that my cells have to eat it too. It's not just me, but it's the little cells that have to eat it so that you can become a better, more whole person, right? So nutrition targets us from the head to the toes. My Fitness, Lady AV, My Fitness Pal is a great way to track what you're intaking and realize portions. Yes. What My Fitness Pal, is that the name of the app? There's also Calorie King that we use here. So I love my tracker. I don't wear it all the time, okay? But I do have a tracker. I don't count my calories as I should, but I'll say what? It's so important to have a diary and to be able to write your connection with food. If some of us are suffering from a disconnection with food, or food has become like a sensation of comfort, number one, you have to understand that it's a spiritual connection. Anything we use, from the lotion, from the baths, from the lotion, from the stuff that we use in our shower, from the clothing that we wear, the way that we treat our clothes. So everything is a spiritual component of how we feel with the relationship that we have about things, even our makeup, okay? So food is an even more intimate relationship. And it's so important to understand that we shouldn't just pick from a box to eat. We should be cooking our food. I'm so glad for you. Did you use a cleanse? So I'm very pro cleanse, because it's going to help set the stage. So it's all about setting the stage. And there's a ton of cleanses out there that we can use. You can make your own cleanse with apple cider vinegar, and it helps for you to make a list. So the idea is to grab a diary, pieces of paper, and start on a Sunday night and start thinking about how you feel when you eat your meal. So every time you're sitting down, you want to consider, if you don't get to document or write every day, it's okay. But it's also really important to understand why you're eating what you're eating, and how you can break the habits of things that you shouldn't be eating, like anything in a box, right? So I love chips. I love chips. Chips are my weakness. I have my pantry filled with chips, and I love tortilla chips, right? And I love my salsa. But I know that I'm giving my body an additional 400 to 500 calories per day just on chips, right? So when I start feeling that I'm out of shape, or when I start feeling a little bit heavier, I can tell because I've been eating more chips and more bananas. And I love my bananas. And there was one aspect of the bananas that I didn't know until, maybe a couple years ago. But when your bananas are browning, or when fruit is very ripe, the sugar, it goes from fructose to sucrose. So there's a change in the way that the sugar exists inside the fruit. And that increases our risk of diabetes as well, if we're having that all the time. A lot of us will say, oh, no, don't have the banana yet, it's too green, and we gotta let it get a little bit more brown. But when it's a little bit more brown, it just has a higher amount of simple carb. So you start changing the component of the fruit. And our bodies weren't made for that. Our bodies are made to have everything complex. We're just complex creatures, right? So our bodies are made to be ultimate machines. Our bodies are made to hit the treadmill, hit that mountaintop, go climbing, go rock climbing. Let me see here. I love the insight. I used to drink a lot of cold pressed juices for detox, but my coach said you lose much fiber with the juice. Exactly. Yes. And I know it's a lot of work to track what you're eating, right? It's a lot of work, but it's so important to track because you're going to find out that you're not eating, you are eating breakfast. So in the mornings, I stopped fasting, and now I'm starting to do a shake. Which shake? I'll use any shake that is high protein. So I stick to pea protein shakes. And I love the different flavors, but I definitely look at the carb count inside the shakes. Then I have another bar that I use, and I look at the carb ratio, right? So for instance, I look at no more than 13 grams of sugar. So maybe next live, I'll ask Be Latina if we can have permission on how to read nutrition facts for all of you. I'd like to teach you how to read nutrition facts. I'd like maybe to leave that up to a nutritionist, because that would be so amazing. But looking over the nutrition facts and understanding what we're looking for. So the nutrition facts are made for somebody who consumes a 2,000 calorie diet. And honestly, I don't consume 2,000 calories per day. I try not to. I try to consume about 1,700 to 1,500 calories per day to keep my weight. Okay, so if we're adding more calories with alcohol, drinking our wine at night, or eating extra cheese, because cheese has a lot of it's a small amount of food, and it has a lot of calories in a small amount of food, you're going to have a higher risk of eating too many calories really quickly, right? So for somebody who wants to gain weight, having that cheese is so good. Like somebody who's pregnant, or somebody who's lost a lot of weight or needs to gain the muscle mass, it's really good to give high caloric foods like avocado and cheese, sour cream, cottage cheese, regular 2% milk. So I'm not really fond of animal milk or cow's milk because of the hormones and the components inside of the milk. So I stick to plant-based milk, right? So I love my almond milks, I love my oat milks, and I recommend those to a lot of my diabetic patients. But if all you can get is cow's milk, stick to skim. Skim is the best milk that you can have. So back to learning about the risk of diabetes. I want to make sure that if you guys have any questions, you ask me, you reach out, you connect with me, because diabetes risk in our community is real. And I want to make sure that as Latinas, as women, we start preparing ourselves to reduce the risk of diabetes. And what happens to us when we don't understand the risk is we start leading this life that's chronic, right? And I want to reduce the risk of chronic disease in women, because chronic disease affects our kidneys, it affects our brain, and there's way too many young women suffering of what? Heart attacks, blood clots, strokes, and that's something that should not be happening right now, okay? In America, and this is all statistics in America, the #1 cause of death for women is heart disease. And heart disease and diabetes go hand in hand, guys. So important for us to look at the risk of our cardio metabolism and what we can do better to make that relationship between our bodies and our nutrition, our nutritional goals for 2022 so much stronger, right? So I want to be back with Be Latina. I don't want to take any more of your time. I want to open up the venue for a Q&A. If you guys have any questions, I am here for you. I want to talk about, checking your blood sugars if anybody has any other questions. Hi, Carlos. Hi, Latina Boomer Mom. How are you? Thank you so much. I am excited to be here and talk to you guys about the risk of diabetes in our Latino community. We want to know, Manal Jakar, we want to spread the news of how diabetes affects us. So what I spoke about 30 minutes ago was, #1, everybody needs to get a checkup for 2022, right? So we want to talk about your risk of diabetes. Everybody get a blood test called a hemoglobin A1C, all right? So that's the first thing you're gonna ask your doctor. Can you please send out a hemoglobin A1C? Then your doctor should tell you the number. Maybe 2 or 3 days later, you're gonna get the result back. Talk to your doctor about the risk involved with that number for you in specific. Anything above a 6.0 is considered diabetes, and you wanna talk about how you can reduce that risk. Secondly, you want to start on a diet and exercise program. Not a diet because you want to diet and keep away from foods, but a discipline of having a sacred relationship between you and your food, okay? So developing that sacred relationship is so important because food makes you feel good. Food brings about feelings and emotions, and it's about comfort, and you should have a very sacred relationship. And lastly, it's movement. So you got to move so that your body can use the sugar that you're giving it. So important, very basic facts. It doesn't have to be complicated. It is not rocket science, but it does have to happen every day, every day, because you got to teach our body how to use the blood sugar. So the holidays are ahead of us, and I want you to enjoy Christmas, and I want you to enjoy January 6th, which is El Día del Niño, is it el día del baby Jesus. So we have a lot of sweets in our culture, and it's not, having diabetes or the risk of diabetes is not a reason to not enjoy our culture. It's a reason to tweak it, maybe make some changes, think about how you can get more active, but not a reason to not enjoy the culture. So important to talk about that with you all. So if you have any questions, hit me up. I'm at Dr. Isabel Bogdan. I'm excited to be here with you all, just continuing this conversation about the risk of diabetes. Last session, we spoke about the risk of diabetes and how it causes harm in our community. And there's also a link with regards to systemic racism and diabetes in our community. And so this is why it's another reason so important for me to come and talk to you guys about this. I love you all so much. Develop these relationships with the things that make you feel good, okay? This is what this is about. Reducing inflammation in our body, reducing the high blood sugars in our body, and understanding where disease comes from, because we are not our disease. All right, I love you all so much. If you have any questions, let me know. Latina, thank you so much for the opportunity to spread the word on wellness, on exercise, and just, you know, overall love, because this is what it is. It's about loving yourself. It's about creating a relationship that you are walking into, which is first with yourself before you walk into it with anyone else. All right, I love you all so much. Los quiero tanto. Take care, guys. Thank you for being here.